So let's have a little look. Let's pick a Noble Biocare parallel implant, CC, its stability in different quadrants. So there's upper anterior, upper posterior, and lower posterior. No big surprises. The grey and the orange are buccolingual and mesiodistal. But I like things where there are no surprises because it helps to validate it for me. So when I do see differences, I can start to understand them. And this is taken from the data set. We can talk about number of samples in just a moment. Let's look at something that's valid. Now, if you look at the Osstell database, they have smokers as risk factors, they have bruxis as risk factors, they have smokers, bruxis who are risk factors. They have so many combinations that you can really start to analyze. I've just picked some smokers here versus non-smokers. So if I looked at the database, we can see a difference. It's not a massive difference, and one is placement and one is loading. But we can see an increase in primary stability, but we can also see a small increase in the loading situation. I apologize for the lack of error bars. It's just purely time that's not allowed me to do a detailed analysis. Then things get quite interesting, really. So let's compare, for example, Straumann bone level implants with Straumann standard implants with Noble Biocare parallel. Now, I could ask this as a question as to who thinks one is more stable than the other at primary stability, but I really didn't think it was terribly diplomatic. So, but let's look in posterior quadrants, and the N for each of these is well over 100. And actually, if you look 69 to 75, they're very similar. The primary stability of these implants is high and good. There's no real difference, which kind of I'm not entirely surprised about. The important thing as well to think about is that Osstell and ISQ measures stability, it measures stiffness. And that's what Bill was talking about, the interrelationship with insertion torque. And placement criteria can have an impact on insertion torque, as we know, between different systems. But ultimately, ISQ is really what matters.